What is the prostate gland? How does it look like? What should we know?
All right, so the prostate gland is a sex gland. It's shaped like a walnut. Is located somewhere at the base of the bladder. I'm sure everybody knows where the bladder is. The bladder is the hollow structure in the pelvis where urine is stored. So just below it in men, there is this gland that's located. They call the prostate gland. It's a sex gland. The job of the prostate is actually to produce what we call prostatic fluid. Prostatic fluid accounts for 25% of the ejaculate. When you ejaculate and release the seminal fluid, 25% of that comes from the prostate gland, and that's the prostatic fluid. That fluid is necessary to nourish sperm so that the sperm can swim up, the female genital tract and be able to fertilize the eggs, and get pregnancy. So that is the job of the prostate gland, to produce this fluid, which accounts for 25% of the ejaculate. All right. The prostate gland is usually about 18 to 25 grams, when it comes to the dimension, and it does this job well. But what we know is that as a man gets older, 40 years and above, this gland can begin to undergo certain changes, and in certain conditions, it can develop cancer. I'm sure we all know that cancer is an abnormal growth in any type of cell. When the cell begins to grow abnormally and it goes beyond the normal restrictions that the body makes for growth of tissues and begins to behave abnormally and can spread to other parts of the body, we say it's cancer. So when cancer occurs in the prostate, we call that prostate cancer.
Now, let's come down to Africa, Nigeria. What is the burden like with prostate cancer? People, we know about breast cancer, cervical cancer. Whenever you mention cancer, that's where our mind goes to. But people don't really understand that there is prostate cancer that affects men. So what is the burden like of prostate cancer in Nigeria?
So I will start by worldwide before I come down to Nigeria. So the Global Cancer Initiative worldwide have found, when they looked at cancers from year 2020, year 2021, worldwide, the commonest cancer in living human beings is breast cancer, accounting for about 11.7%, closely followed by lung cancer, 11.4%, and then colorectal cancer, about 10%. The fourth commonest cancer is prostate cancer. Okay? Now, when you come down to Africa, come down to black men, the commonest cancer in black men is prostate cancer. It is also the commonest cause of cancer-related deaths in black men, including Nigeria. Okay? This is because lung cancer and colorectal cancer are not as much here as compared to overseas. So prostate cancer is the leading cancer in black men, in Nigerian men. It is also the cancer that causes most deaths in Nigerian men. Hospital-based studies in many hospitals in Nigeria initially put the prevalence at about 105 per 100,000 men and 182 per 100,000 men, as reported by Badmus et al., my teacher, and Osebo et al. In Lut, Lagos. But about 5 years ago, one of my mentors, Professor Ekpoma in Lagos, went to do a community-based study. When you wait in the hospital, you end up seeing just sick people coming there. So it was better to go to the community and then screen men in the community. And they found a prevalence of as high as 8,070-something men, 100,000 men, having prostate cancer in the community. So this tells you that we have quite a huge burden of prostate cancer, in our environment. 1 out of 10 to 12 men, in Nigeria will have prostate cancer when given enough time and screened at the right age.
Thank you very much, sir. Now, please tell us the risk factors for prostate cancer. To make it snappy.
Yes,
I think to make it snappy, let's just run both the risk factor and maybe the symptoms of we'll see for a patient that will present with prostate cancer.
All right. Okay, that's fine. So for the risk factors, we only mentioned is a disease of men. Then the age is a disease of older men. So the peak age of men that with this disease is usually 60 years and above. Between 60 and 70 is the peak age that they present, okay? But you must be aware that the older the man, the higher the chances of developing prostate cancer, all right? And also for the urologist, we are less worried the older the man is. So for instance, the man that is 95 years old and comes with what looks like prostate cancer, you're not as worried, because he's likely to die with the disease rather than from the disease, if you know what I mean. So we are more concerned when the patients are younger. Okay, so men who are less than 60 years old with prostate cancer is the worry, because this accounts for about 20% of men with prostate cancer, because this is usually associated with more aggressive disease and the outcomes are usually a lot worse. Okay, family history. We have what we call familial prostate cancer. So men who have their uncles, fathers, brothers or so who have died from prostate cancer, who have developed prostate cancer, increases the risk of having prostate cancer in them. Okay, and the familial type is also worse because it usually occurs in the younger age group. Okay, so cigarette smoking, obesity, all right, deficiency of certain trace elements like selenium and zinc, all right, these are all risk factors that we are aware of. Also, use of exogenous androgens, people like some athletes that abuse testosterone and all those kind of things. High doses of this can also stimulate, prostate cancer. And then, the controversial one when it comes to sexual exposure, I'm sure you've heard about the study by Ryder et al. That said that men who ejaculated in the excess of 21 times per month appeared to have a lesser incidence of prostate cancer than those who ejaculated 4 times or less per month. So, but this is still something that people are studying and people are looking at. So these are some of the risk factors, that are very commonly associated with prostate cancer. And then, how do these men present? They present in a wide variety of ways. Okay, they can be asymptomatic. This is especially in populations where they have a good prostate cancer screening program, where men that are 50 years and above just go to the hospital every year to see their urologist. All right, they have their PSA checks, have their prostate examination, their ultrasound every year. So what this means is that when there's any little change, a small rise in the PSA level, a small abnormality in the prostate, is picked very early. And, so that is, the guy doesn't have any symptoms. Nothing is wrong with him. So usually, these are the people that have the best outcomes. They can present with evidence of local dysfunction from the prostate. As I said, the prostate is located at the base of the bladder. Okay, so where the prostate is where urine should flow out from, if you know what I mean. So the man can have some difficulty with passing urine. When he goes to pee, he has to wait for some time before it comes. When it comes very slowly. He has to be pushing. He has to wake up 10 times in the night. Sometimes he may have some blood in his urine. He may have some blood in his semen and stuff like that. Those are local things from the prostate being enlarged by the cancer. So they can present that way as well. They can present from evidence of local advancement. Okay? Around the prostate, at the back of the prostate, you have the rectum. So the cancer can invade the rectum and they will have constipation, blood in their stools. The cancer can affect the nerves that run by the side of the prostate that supply erection. The man will not have a good erection anymore. They can present like that. And then finally, they can present with what we call metastasis. If the cancer is long gone and has spread to other structures, they can present that way. The prostate cancer most commonly spreads to the lower backbone, the vertebrae at the back, and the pelvis. Okay, so this can cause severe low back pains. They may not be able to stand up. They may not be able to walk. They may not be able to control poo-poo and wee-wee again because of cord compression. It can spread to the long bones, like the femur, that's the one on the legs, and then the long bones on the hand. The guy will be having bone pains. You get bone pains. You know what I mean? You get bone pains. All right. So these are evidence that it has spread. to the bones and all that kind of stuff. Sadly, in Nigeria, 70% of our patients that present at advanced stage, like metastatic stage. So you are wondering why the outcome in our people is so poor. When you come that late, then it also restricts the kind of treatment that the patients will get. So these are the ways that our patients present.
Now, sir, I want to ask you about the treatment. Most times when people hear prostate cancer, everything that goes through their mind is that, oh, surgery, operation. Can you please help us break it down? What are the possible treatments for prostate cancer, and what has been your own experience with the management of patients with prostate cancer? Yes, sir.
So, what we do, the treatment that we give to the patients with prostate cancer depends on many factors. One, the age of presentation. Is it a younger patient or an older patient? Number two, the stage of the disease. Is it early disease confined within the prostate gland, or is it a disease that has spread very far? In the histology, when we confirm that there's cancer in the prostate, I'm sure for us to confirm that there's cancer in the prostate, after all the blood tests, all the imaging like the CT scan, MRI, bone scan, etc., we do what we call a prostate biopsy. We take some part of the prostate through a surgical procedure and send to the laboratory. There we have the pathologist look into the slides and tell us, is there cancer here or not? If there's cancer, how aggressive is it? Has it gone? Has it spread far? Things like that. They tell us some details that are very important to us. So those details are also very important to tell us what treatment to give. What of the fitness of the patient? What we call the performance status. Is he strong, or is he a guy that can't even walk, can't do anything? You can't subject somebody who is unfit to things like surgery. You understand what I mean? So there are many factors that we put together before we decide what is best, okay? As I said, for those who present with early disease, that means the disease is confined within the prostate gland. It has not spread anywhere. You check, everywhere is clean. He's fit and strong. Such patients, you want to offer a curative, intent. And you do this by either what we call radical radiotherapy, whereby we use radiation to shine on the prostate to destroy the cancer cells there, okay? Or what we call radical prostatectomy. That is a surgery where we go and remove the entire prostate gland. This can all be offered in Nigeria. All right? When you do this, the patient is back to normal, he's cancer-free, and he can live the rest of his life free and keep coming for checkups to ensure that he doesn't come back. However, I must tell you that only about 10 to 20% of patients in Nigeria can even think about benefiting from this. This is because only few patients come in such stage. Most of the guys you see in Nigeria have back pains, they can't walk, they only have pains, PSA is 1,000 plus and things like that. So it limits the options of care. So when you have advanced disease, most of your intent is what we call palliative care. Palliative care means that your treatment is just ensured to slow down the progress of the disease, keep the patient comfortable and pain-free, and push him as long in life as possible. Do you understand? So this is a different kind of intention from when you are going to cure. And we know that prostate cancer, the prostate itself, is highly dependent on the hormones that make us men, that's what we call testosterone, that is secreted by the testes. Okay? If you remove a man's balls when he's a young boy, he can never develop prostate cancer. Alright? So this is the mainstay of the treatment for those advanced disease. Our aim is what we call androgen deprivation therapy. So what we do is either we give drugs that suppress the testosterone levels to zero, or we go to the surgery and cut off the testicles. Either way, you are doing the same thing. When you do that, you slow down the progress of the disease. The prostate is quiet because it's no longer feeding on testosterone, so it gets shrunken, and if it has spread to the bones and all those also go quiet, and the man enjoys the new lease of life. The only problem is that in some patients, especially younger ones, they cannot. This phase may not last like that forever. Sometimes they can progress within 3 years to what we call castrate resistance. They can begin to progress again despite having this kind of treatment. So so this is the mainstay of treatment for those with prostate cancer.
How can we prevent it from occurring, the prostate cancer itself, if we really want to prevent it?
Yeah, so I think the complications will be more for the treatment and not the disease, because what the disease causes will be the symptoms. They are not complications, they are the symptoms, the way it spreads and what it does, like what I've said already. All right. So, but the treatment can have complications, just like every other thing. For instance, for those who you want to offer cure by the things I mentioned, radical radiotherapy or radical prostatectomy, they can have issues with erection. Erectile dysfunction is a main complication because the nerves that supply erection, what we call the cavadosal nerves, run just by the side of the prostate. So, of course, many of the men with this disease are elderly men, so they already have very poor erections. But some of them may have poor erections from their aging. Some may have poor erections because the prostate cancer has affected the nerves. And some may have it because while you are trying to treat by radiation, you can also damage those nerves, or by surgery, you can also damage those nerves, erectile dysfunction. You can also have what we call urinary incontinence. During the surgery or radiation, it can also alter the sphincter that controls makes you able to control urination. So they may just be leaking urine. But usually in good hands in surgery, this doesn't happen much. Only about 10% of them have that after 1 year of surgery. So we have all the cases that we've done, we don't have any of them having that kind of urinary incontinence. And even if they do, now there are options of treatment for that, like artificial urethral sphincters, etc., sling surgeries, etc. All right. Also, you can also have effects when it comes to the drugs that we give, like what I mentioned. Okay, these ones can cause loss of libido. They can cause erectile dysfunction themselves. And it can cause what we call hot flushes, just like women have during menopause. The man sits down suddenly, he just feels a lot of heat. Everybody is calm, he's sweating profusely. All right, so we call that hot flushes. This comes as a result of androgen deprivation therapy because you altered the hormone levels in this man, what makes him a man. Okay, so these are the commonest complications that you can have from the treatment that comes with prostate cancer.
Can we prevent prostate cancer? The whole discussions, the causes, risk factors. Is it possible that we can prevent prostate cancer? If yes, what are those steps we can take to prevent prostate cancer?
For prostate cancer, it's quite a difficult one because one, being a man already puts you at risk of having. All right, but the things you can do are one, as I mentioned, try to eat a healthy diet, rich in trace elements like selenium, zinc. So what this means is that fruits and vegetables, which are very rich in minerals and trace elements, should be a mainstay of your diet. All right. Number two, obesity. You can alter obesity by keeping fit, being in the gym, eating healthy. So when you are fit and when you are not obese, you reduce the risk of having prostate cancer. Dangerous behaviors like smoking, and stuff like that, you can avoid them because they are known, to be risk factor for prostate cancer. All right. So this would be what we call primary prevention. You don't have the disease, but you are preventing yourself from, being at risk of this disease. Then we have what we call secondary prevention. Okay. What this means is that in a situation whereby somebody is at high risk of having this disease. I mentioned already that there are men who already have a family history of this disease. Being black men in the first place, we already at a higher risk of developing prostate cancer than Caucasians. We have a 2 times to 3 times chance of having this disease. So what it means is that from when you get to 50 years of age, my advice is that you see your urologist annually. He talks with you. He examines your prostate. He does your PSA check. PSA is what we call prostate-specific antigen. It's a tumor marker that we check in the blood. The normal range is between 0 and 4 nanograms per ml. When we see the values greater than 4, we begin to suspect whether there's prostate cancer or not. We do imaging. It can range from just normal ultrasound scans. And if it's more suspicious, you can do what we call an MRI. All right. So when you do this annually, you are keeping yourself in a good position. So what it means is that you have a chance of, if it's going to be a problem in the future, you get it early and it can be cured. Do you understand what I mean? So this is also another level of, looking at, prevention of prostate cancer. And then, of course, for what we call tertiary prevention, those that already have prostate cancer diagnosed, you must present yourself to the specialist. Go to the people that know what they are doing. In our environment, we notice that a lot of our people with this disease present to the churches, they go to the mosques, they go to the chemists and pharmacies, and they give them all sorts of drugs, just taking anything. All right? They say, Mr. A, he had prostate problem. Come, this is what he took. The prostate has so many diseases. It can be BPH, enlargement. It can be prostatitis, coli. It can be, and all these have different type of treatment. So, don't play around with this. Once you have your father, your brother, your uncle with this kind of condition, take them to see the specialist. Don't even waste time. So this is how I will address, the prevention of prostate cancer.
It says the place of supplements. What is the place of supplements and prostate cancer? Because now people go around buying supplements to help them prevent prostate cancer. Can one actually take supplements and you will be free from having prostate cancer?
No, I don't think any supplements help. As I already mentioned, I told you that if you have a diet that is rich in trace elements, in the minerals, zinc, selenium, those offer you some degree of protection, against prostate cancer. A healthy diet, preventing obesity, staying fit, preventing dangerous behaviors like smoking and things like that. So the supplements, people just market many things to make money and all that. So
there's another one again, saying, at what age should I be? Okay, I'm 28 and I'm planning to conduct my first check next year. Am I too late?
No,
28.
No, you are too early. That's not the age for prostate cancer. From 50 years of age, you should begin to screen for prostate cancer. If you have a family history, if your dad, your uncles, have died from prostate cancer, then from 45 years old, you should see the urologist every year. 28, you're too young. We don't see the disease in that age group. It's so rare. It's so rare to see it in that age group.
Someone is asking, saying that, can prostate cancer spread to other parts of the body?
Can what, sir?
Can prostate cancer spread to other
Can prostate cancer?
Oh, yes, I mentioned already. I mentioned that the predilection is to the bones. So the first place is the spine. It goes to the lumbar vertebrae and the pelvis first. So low back pain, inability to walk, paralysis, yes. It can spread to the long bones like the humerus, the femur, bone pain, the long bones. That's where the prostate cancer likes to spread. We've seen, if you go on Google, you can put my name and type unusual presentations of prostate cancer. You're going to see a paper that we wrote many years ago where we highlighted some of the unusual ways prostate cancer can present. All right? But in our environment, 70% of our patients present with advanced disease. So it's either locally advanced or metastatic disease. So it can spread to different parts of the body. The bones are the commonest, the ribs, the skull, just like I mentioned in that order. Okay, rarely you can see it going to the lungs, to the viscera, but not commonly. So most commonly is the bones, as I've spoken, yes.
Chinedu is asking, can a younger age get prostate cancer?
I don't know what younger age means. I've already stated the age group that are most susceptible, but we have seen young patients. I've seen a patient who was 42 or so, and one that was 38. But those are very, very rare. I mean, that's out of about 1,000 patients. You can see